Hi, everybody. My name is Michelle Luthi. I am with Lolly Insurance. I have Nancy Nimmo here with me. She's my coworker. We work primarily in the Medicare and individual health insurance space. Providing our clients, with options that work best for them. So, a lot of what we do is in the Medicare space, but we also deal a lot with the New York State of Health Marketplace. A lot of times, if we have a client, that's 65 and retiring, but their spouse is not yet of Medicare age, what are their options? So I'm here to tell you there definitely is options. And we'll talk a little bit about that today. If there's any questions, you can put them in the chat if you'd like. Obviously, we'll pause at the end if anybody wants to ask the question then. So the New York State of Health is the official health plan marketplace. So this is where people will go to obtain health insurance. So it is not a platform for those who are, currently insured through an employer. It's for those that are maybe retiring, lost their jobs, had a significant income change. Maybe their spouse is retiring and, they're eligible for Medicare, but they're not. It's also a space for children to get insurance through a program called Child Health Plus. So we will talk through that as well. And Nancy, I'll say too, if you want to add, please jump in. So what we're going to talk about here, I want to preface by saying it is subject to change as of January 1st of every year. So plan availability, rates, plan design, which we won't get into too much detail. That is all going to be subject to change as of the first of the year. And I just, link the website here for the most up-to-date information. Okay, so why might you enroll into the individual marketplace? You're retiring, but you're under age 65, so you're not eligible for Medicare. Losing employer-sponsored health coverage through, voluntary or involuntary termination. If you have children who are aging off the family health plan at age 26. If you're self-employed, if you're a sole proprietor, maybe you are an individual who just started a new job and you have a waiting period before you can go on your employer's health plan probation period. And again, you're enrolling in Medicare, but your spouse is not yet there yet. Okay. So when you retire, COBRA is not your only option. Now, depending on what your COBRA coverage looks like and what your premium is for COBRA, it might be the best option. But really, Nancy and I, in Lolly are here to help you come to that decision. Through what your needs are, your prescriptions, things like that. Those are all things that we take into play. So most of us know that COBRA is an expensive option and it's not forever. There's various options for individuals to obtain health insurance, whether it be by enrolling directly with a local insurance carrier or enrolling on the New York State of Health Marketplace. So we're here to help you explore your options. So I'll say, COBRA could be an option. Enrolling through the New York State of Health Marketplace is an option. And then, we do have some clients that'll say, you know what, I don't want to bother going online, putting all my information in there, putting my income in there. I know I'm not going to qualify for any tax credits or assistance with my premium. So I just want to buy a plan directly through an insurance carrier, like an Independent Health or a Highmark Blue Cross Blue Shield. And that is an option as well. Okay. I'll say that if you do decide to go that route, um, if you're eligible for a tax credit, which there is a way to determine if you are based on your income, you will not get that tax credit if you're enrolling directly through the insurance carrier versus through the New York State of Health Marketplace. So you can qualify for a tax credit on the New York State Marketplace. Your children could qualify for Child Health Plus, which is great for cost control. There is a really easy transition that we help our clients with, from going from individual coverage to, oh, now they're 65. So we're going to take you off the marketplace and show you what your Medicare options are. And then we would assist you with understanding your different premium plan options, your plan benefits, and more. And then I'll say this, not every insurance carrier is going to cover the same prescription. Highmark might charge you more for a prescription than Independent Health does, and so on and so forth. So it's kind of our job to sort through all that, and tell you what your best options are. So the New York State Health Plan Marketplace is a one-stop shopping for subsidized and unsubsidized coverage. It allows you to easily compare your health plan options. You do get personalized one-on-one help. And there is, I think it's in the next slide, there is a spot on the website that allows you to check your eligibility to determine, if you were to move forward and purchase a plan, are you going to get any financial assistance? Are you eligible for a tax credit? So the different types of plans that the marketplace offers include qualified health plans, the essential plan, Child Health Plus, and Medicaid. And these plans are available to New York State residents. Okay, what are the covered benefits? Pretty standard here. There is no cost for preventative care. So things like routine physicals, you know, mammograms, flu shot, colonoscopy, things like that. You're covered for inpatient care, outpatient services, maternity and newborn care, emergency services, labs and imaging, prescription drugs, rehabilitative and habilitative services, mental health and substance abuse disorder services, wellness and chronic disease management. And there are plans out there that do offer pediatric, dental, and vision. And then some also do adult dental coverage as well. Okay, so this slide speaks to Child Health Plus. Now we have a lot of clients, that are, say, on, a family plan currently with their employer. But maybe there's an offering of Self Plus One, and there's an opportunity to get their children off the plan and covered through a program called Child Health Plus. So I'll say that every child up to age 19, yes, I'm right, 19. Okay. Is eligible for Child Health Plus. If you are the dependent of a New York State retiree or current employee, you are not eligible for Child Health Plus, but anything else you are. It's just that your premium, if you pay a premium for Child Health Plus, is going to be based on your household size and your income. So if we are at, let's say, a household of two people, so maybe we have a mom and a child, and the monthly income is $37.82. then that child is going to qualify for free Child Health Plus insurance. Okay. If we are at 42.59, then their responsibility is a $15 premium per month for the Child Health Plus plan. It's a great option. Whoops, go back. I'll use an example here. So, I am on a family plan with my husband and my daughter, and we're on a pretty high deductible health plan, right? And my daughter needed to get her tonsils and her adenoids out. And I knew that was going to put a big dent in our deductible that I didn't want to make. So I got her off the plan. I put her on Child Health Plus, and I paid the premium, and there was no copays. So I was paying a little bit of a monthly premium, but at the end of the day I didn't have to worry about that deductible. So it could be a good cost saver for some people. Now there is a maximum here. This says the full premium for Child Health Plus is around $220 a month. So that's the maximum that somebody could pay for their child based on their income. Okay.
What? So being a finance guy, thank you.
Mm-hmm.
Is that? I'll just go to the free insurance for a second here. The $5,772. Is
Yeah.
that gross pay or is that net pay? Because some self-employed people might make 5,000, 6,000 a month, but after deductions and expenses, they might be under that. So is it gross or net?
It's gross.
Okay.
Yes. So I mean, it could be a good option for people. We can always crunch the numbers. Let's say if you have a child or a couple kids that are covered under a family plan, and maybe, like I said, there's an opportunity to cut down on that cost and maybe do a single plan or a Self Plus One. We can see if this is a good option for you.
So in this chart, the 60, so you got 5,772, and then you got the 6,500. Once you're over the 5,772, you pay $15. Once you get over to 6,500, you pay the $30, so
30.
forth and so on. Correct?
Yep. Yes.
Okay.
So, and then
Thank
the
you.
full premium would be it's about $220 a month.
Okay.
About that. Okay.
Thank you.
Hey, you're welcome. So I'm gonna see if this is gonna let me share. So we often use this tax credit calculator. I don't want to say often, we use it all the time. Just to give people an idea of if they're going to get financial assistance if they enroll through the marketplace, and if they are going to get it, how much is it going to be? And is it worth it to go this route, say, versus getting Cobra or so on and so forth. So I am going to go back to oh,
So on the Child Health Plus, while you're trying to figure
yeah.
that out, on the Child Health Plus, if a child is on that plan, there's no difference between like a traditional HMO or PPO versus a high deductible plan. It's all one standard plan for Child Health Plus.
So Child Health Plus is going to give you the same benefits with one carrier versus another. So if my daughter, if I put her on Highmark Child Health Plus plan, it's going to give me the same coverage as if I put her on Independent Health Child Health Plus plan. What could vary a little bit is the premium. So, I want to say that, a full pay, let's say Child Health Plus plan with Highmark is like, I don't know, I think it's like 222, and the independent health is 220, but the benefits are the same. Another thing that can vary is one insurer can cover a doctor that the other doesn't. Or, one might cover a prescription at a different tier than another. So it's sort of our job to get all that information from you and figure out, what your best choice is. Okay, I'm
So
gonna,
I guess,
yeah, sorry, go
like
ahead.
if my child goes to a local pediatrician and then for years through my employer, I had Highmark, but now health is $2 a month cheaper. People might lean towards a cheaper premium because that's how people shop for insurance. Go to a cheaper premium, whereas then they might find out the hard way that, hey, they're out of my network and they're not covered anymore. So I guess that's a good thing to know is as you're shopping your child health plus or any health insurance, that if you really like your doctor and want to stay with that particular doctor, especially pediatricians, because most people like their or hope they like their pediatrician that they don't want to change, that they should probably inquire about the doctors and coverages before they actually make the change prior to looking at the price.
Absolutely. Just bear
Right. I
with me
think it's
one second
important
here.
in any situation, whenever you're changing health insurance providers, that you do confirm that the providers are participating. That's one of the steps that we take here at Lolly is confirming your doctors participate in a health plan before we would even recommend. When it comes to our local carriers, they do have very strong provider networks.
Mhm.
So local carriers being Independent Health, Univera Healthcare, and Highmark Blue Cross Blue Shield, you will find that they have the strongest provider networks out there for all of their health plans, in comparison to the carriers like United Healthcare, Humana, Aetna's. Those are all national carriers, and their provider networks are not going to be as strong. So whenever switching health insurance plans in any situation, it's recommended that you do confirm provider participation.
Yeah, and I guess that's the advantage of hiring a company like Lolly to help navigate that because most people would just go online and pick the cheapest price and then come to find out that their child has an ear infection and goes to the doctor and they get $120 bill instead of just paying a $5 or $10 copay or whatever it might be.
Right.
What are you
Good.
guys seeing compare plans and estimate cost? What are you seeing?
I see your PowerPoint screen.
Why is this not
Do you
working?
have multi-monitor?
Yes.
All right, hold on one second. I think that's why I have multi-monitor checked. You might have to stop the share and then when you hit the share button, click your other screen.
State or this one? Mm-hmm. Sure. How about now?
Yep, now I can see it.
Okay, it says compare plans and estimate cost.
Yep.
Okay, perfect. Okay, so this is going to be the tool that we use. The website is linked in the PowerPoint. We'll go back to that to determine if you're eligible for a tax credit. So I'm just gonna enter 14224. I'm not a robot, and here's where we're at. So we're going to say that we have two people. So you're gonna select the county here. So it's gonna ask for how many people in the household. So we're going to say, oh, this thing keeps out. So two people in the house, let's say both of them need coverage. How many kids under 19? We'll say 0. Are there any dependents age 26 to 29? No. And we're gonna say that their income is 100,000. And then we're gonna calculate. And you'll see here that these people are eligible for a tax credit of $317 per month. Okay. So here, if you scroll down here, are all of this individual or the couple's options. So I mean, there's different metal level plans. They go from platinum, gold, silver, bronze to catastrophic. So let's just look at a platinum plan. Search that out. And let's say I want, a top of the line plan. That would be platinum. If I go with independent health, I'm gonna pay about $15.66 a month for myself and my spouse. And then you can see, Highmark, the same type of plan, platinum is about $1,700 a month. Univera is $8,500 a month.
So with the
No.
credit,
Mhm,
so when you're seeing the price per month and then what you pay,
mhm.
they don't like reimburse you the credit. It's actual monthly payment to the insurance carrier to 300, and then thus I have to make up the difference.
Correct. So I mean, there's two ways that you can apply your tax credit. The first way is just getting it, right off of your monthly premium. So instead of paying independent health the 1883, you're going to pay them, 1566. The second way is you can reconcile it at the end of the year during tax time. We really don't have many clients that do that. A lot of them
Right.
choose to, have it, be taken off their monthly price.
Right.
Um, and then maybe not, a platinum plan is not, something in the budget. So we'll go silver and we'll search this. And, we'll have, looks like,
I know this is a
Fidelis.
top. Oh,
Yeah, I was
go
just
ahead.
gonna say Fidelis Care is, you'll typically see that as your lowest plan. But we do caution people because they don't have the network of doctors that the other local carriers like Highmark, Independent Health, or Univera have. So yeah, you're gonna pay a lot, but we need to double and triple check that they're gonna check your, cover your docs and your scripts.
Now, to know, so we talk to a lot of our clients about HSAs, health savings accounts, and I know we
Mhm,
won't get into that too much what they are. We'll do a separate video for that.
mhm.
But for HSAs, if I'm getting a credit from the premium, am I still allowed to contribute to an HSA if the plan qualifies?
Michelle, you're on mute.
Sorry. There are
That's okay.
HSA qualified plans. So like this one is the HSA with independent health.
Oh, okay. I see
Um,
what you mean.
yeah,
So even though I'm getting the credit, I can still contribute to an HSA.
yes,
Okay.
yeah.
That's
The only,
interesting.
yeah, I mean, just if you're on Medicare, you can't contribute to an HSA.
Right.
That's
Right.
a whole new, that's a
Yeah,
whole
that's
more
a,
new, a whole different animal, right?
yeah,
Um,
for sure.
so yeah. Um, So does anybody need me to do any other numbers here? Need to play around with this a little bit? Nance, I don't know about the chat here. The essential plan, is it basically Medicare? So the essential plan is, I actually, you know what? That is going to be on my next slide. So why don't we go back to the PowerPoint here? Are you guys seeing the PowerPoint?
No.
Okay.
Gonna have to stop the share and then restart.
How about now?
Yep.
Okay. Let me just make sure it did. Okay. So the essential plan. So the New York State Essential Plan includes comprehensive benefits with 0 monthly premiums and very low cost sharing. The cost sharing that's referred to here is basically going to be your copay. So a lot of times in the Essential Plan, you'll see a lot of $20 copays, $20 copay to see your primary, 20 to see a specialist. There's no deductible, so the plan starts paying for your health care right away. So unlike the other plans that we just viewed, so your silver, your bronze, um, those type of plans, not your platinum, your gold plans. Those plans are all going to have a deductible that you have to reach before your copays will start. The exception to that rule is if you're on a platinum plan, you're paying a much higher premium for it, so you're not going to have to reach a deductible. You're just going to have copays. But the essential plan here is going to be based on your household income. It includes dental and vision, inpatient and outpatient hospital care, prescription drug coverage, and more. There's no copays for preventative care like routine exams and screenings. And essential plans have a continuous enrollment. What that means is, let's say you are no longer working, whether you're retired or maybe, you were let go from your job and you're going to have a significant decrease in your income. And maybe it's not open enrollment yet because open enrollment for the New York State Marketplace is in the fall. So let's say we're in the summer and you've lost your job and you need insurance. Well, number one, that's a qualifying event. And number two, you might qualify for the essential plan and the enrollment is continuous throughout the year. So this is kind of a small chart that says the eligibility for the essential plan. So, if you're a household of one, you can make up to $37,650 to get this essential plan at no cost. And then, like if you're a household of four and you're at 78,000, you would be eligible for the essential plan. Okay. So there's various ways you could enroll. I have this up here, but as always, we would love, to help you navigate this. There's assisters and brokers located in every county. You can make, a phone appointment to get assistance with that. Or you can call us here at Lolly, and we're happy to help you either over the phone or in our offices. Nancy and I work out of our office in West Seneca, right in the Southgate Plaza. But we do have other offices across New York State, really, and even beyond. So in this area, we're in downtown Buffalo. We have an office in Williamsville, obviously West Seneca, Jamestown, Dunkirk, Rochester, Batavia. And then outside the area, Mahopac, Connecticut, New Jersey. So there's a lot of offices here that Lolly has branched out to. This is the website for the New York State of Health. So if you're feeling like you want to play around with it and look around, you can do that. But again, we're definitely here to help navigate this process for you.
I would just like to add, if you
Yes.
do choose to send your clients to the New York State of Health Marketplace, my experience with the marketplace is they have a very high turnover rate, and sometimes you'll get different answers with the same question. So we would love to be a resource for you guys at any point in time if you have any questions or concerns. And if we don't have the answers, we have a direct contact with the marketplace as well.
Well, I'm sure it's easier to get a hold of a 716 phone number than an 800 through New York State for anyone that's ever tried to call the state.
Yeah.
Yeah, and I'll say this too. I don't know if I already said this. Let's say you need health insurance, but you're not going to qualify for a tax credit. That's okay. We can still proceed with getting you insurance through the New York State of Health. Or like I said, some people say, oh, the heck with it. I don't want to put my income in there. I know I'm not going to qualify. Let me just purchase a plan directly through Highmark or Univera or Independent Health, and we can help facilitate that as well. So one other thing I want to put up here is just some information about just about all the services that we offer here at Wally. So we talked about the New York State of Health Marketplace plans, Medicaid Essential Qualified Health Plan, Child Health Plus, individual and family plans, that ties in with that. We also help with Medicare Advantage, Medicare Supplement, prescription drug plans. We guide and educate individual on the always moving parts of Medicare, A, B, C, and D. We do offer personal situation review and prescription drug analysis. We will double check your doctors are in network, and we will assist you with all enrollment and application completion, whether it's with Medicare, the New York State of Health, or directly through a carrier.
Good. I have a few questions that I want to ask real quick. Hopefully, the Affordable Care Act was passed. I don't know what are we, probably 12 years ago, 16 years ago, somewhere in there.
Somewhere in there.
How many insurance companies have left the marketplace versus the first few years that the Affordable Care Act was enacted?
I don't recall any have left, Nance. I know that there were a few that did not join right away. Like I know, Independent Health maybe like wasn't on board for the first year. They joined a little bit later, but I don't recall that anybody has dropped out.
Maybe they have reduced the number of plans that they have offered on the marketplace,
Oh, okay.
but not necessarily the carrier leaving. Now, just to add to that, we have seen where the carriers are requesting significant increases for 2025. And that increase is anywhere from 10 to 20% on average. That's just estimating. I think Independent Health was a little over 20%. That's what they're requesting as an increase to the premiums for 2025. That's not a guarantee that the state's going to approve it. So we are looking forward as things are going to be increasing as everything is. So I just wanted to throw that out there just to be aware. There also, some of the plans and carriers are moving to reduce the number of plans that are offered for next year. So
actually, that was going to be one of my next questions. So when these insurance companies do propose that they increase premiums, does it affect the marketplace? And I guess the answer is yes, it does affect the marketplace when they propose rate increases. So yeah, that was one of my questions too. I wrote down as Michelle was going through the presentation. So cost comparison, excuse me, like if I'm have insurance through my employer, excuse me. If I have insurance through my employer and then I go out on the marketplace, is there a big discrepancy in the price? Whereas like, say I worked at Rich Products, for an example. I don't know why I picked Rich's, but we'll use Rich Products, has over 1,000 people that work there. They're probably getting a pretty good rate on their health insurance. And then I leave Rich's Products to start my own business and I lose that insurance. Is it comparable like on the marketplace as like a group rate per se? Or am I probably going to be paying more on my own?
The marketplace is definitely all individual rates. They're completely
Okay.
separate from group. I would say it's hard to really answer whether it will be more or less because group premiums can vary.
Right.
So it's hard to say what would be more or less, but when you go on the marketplace, those are strictly individual rates,
Okay.
separate from group.
That's
Yeah.
okay. That's kind of what I was getting at anyways, but yeah. Okay.
You're also losing the employer subsidy. So going from
Right.
Rich Products, where Rich Products is subsidizing what you're paying for your health insurance. So you're not paying the full premium at Rich Products. Going on your own, you are responsible for the full premium if you don't qualify for a tax credit.
And how long does somebody have? I know you mentioned Cobra at the beginning of the presentation. What is the time period that somebody could be on Cobra? You know, let's use Rich Products again. Say it's going to be still cheaper to go on Cobra than it would be on an individual plan. How long can I stay on that for?
It's usually 36 months that you could be on
36.
Cobra.
And then did you see the question in the chat?
Let's
You
go
want to
to the
touch on
chat.
that?
Oh, I was actually typing the answer back.
Oh, okay.
Nope.
Okay.
It's no
No, I
worries.
think it's a good question of, bouncing back and forth because people in
Great
today's day and
question.
age might jump jobs.
Right. So if you have a qualifying event, that's always going to be an opportunity for you to enroll in the marketplace. Speaking like Child Health Plus and the Essential Plan and Medicaid are three of the plans that are offered through the marketplace that you can enroll in at any time. Without a qualifying event. It's just because you merely qualify for those three products. When we speak about a qualified health plan, which are the metal levels, the bronze, silver, gold, and platinum, other than the annual open enrollment, which is from November 15th through January 31st, you have to have a qualifying event. So if you leave your employer coverage, that is a qualifying event to enroll in a qualified health plan. Other than that, you can't just hop back and forth like the other three types of products that are offered on the marketplace. Does that
I
make
hope
sense?
I think so. I think who asked that? Juliana may ask that. Um, do you have any follow-ups there, Juliana, that you want to?
Nope,
That was
that
a great
answered my
question.
question.
Great question.
Yeah, I think we're out of questions. And again, here at Buffalo First, we want to thank you guys for taking time out of your day on. It's funny, we have clients all over the country, and if I told them it was almost 90 degrees outside, they'd probably be telling me I'm lying. But certainly it is a nice day, and we really do appreciate you guys giving us this valuable information that we can pass along to our clients to make sure that they're all set with their not only navigating into retirement, but also navigating job changes or navigating the New York State Health Exchange, which I think you mentioned it several times, can seem overwhelming and daunting all at the same time when trying to navigate and understand insurance. So we really do appreciate your time and you guys jumping on and going through that.
Yeah, thanks so much for having us. So again, I'll just say that open enrollment for the marketplace starts on November 15th. We're already getting questions now, or what's my rate going to be for next year? I mean, that's kind of all up in the air. Still waiting on DOH approval. I would expect probably maybe end of October, beginning of November. The rates for the carrier should be approved, and posted, and ready to go live for, November 15th. So, if there's any questions that come up, please don't hesitate to reach out. I think I had sent you over, Alan, the flyer, with my contact
Yep.
information on it. And yeah, we're happy to help you and your clients navigate this and answer your questions and, make sure you're in a good spot.
And if I can add, Alan, you mentioned you had clients all over the country. Michelle and I and Lolly, we're only licensed brokers in New York State for the New York State of Health Marketplace. Whereas other states do have marketplaces, they're either on the federal exchange or they have their own individual marketplace like New York State of Health. For example, Pennsylvania, they have the Penny. We're not licensed to do that, but we do have contacts. So even if you have a client out of state, we're happy to find that contact for you in other states. We have a growing list of other states and contacts.
Great. Yeah. It's when I said, now that you mentioned that, I said that in on the investment world, we can have clients all throughout the country. Insurance operates a whole different ball game than the investment world. So I appreciate you tacking that on at the end.
Yes. We get questions all the time for other states and we're like, yeah, I mean, the idea and the logic behind the health plans on the marketplaces in other states, they're very similar. But like, you're not going to find the essential plan in Pennsylvania or other states. That's a New York State benefit. So other states do have different things that we may not have, but we would like to get you to the correct contact for those states to help navigate through the plans in other states.
Good, thanks. Well, I'm going to thank you very much. I appreciate your time, and
Yeah.
I'm going to stop the recording.
Okay.